With police often in frequent contact with those prone to HIV infection, they can do much in terms of education and prevention. We stopped by the press conference today to hear how.
I'm talking about sex workers that have a prevalence of 11.2%. Then we are talking about MSMs who have a prevalence of 17.5%. And therefore, realizing this as a national strategy, the Ghana Police realized that it has a role to play so that we don't antagonize these populations, thereby forcing them to go underground and then increase the rate of infection. After the police administration has given the go-ahead, we try to tackle those who are in the system already by introducing in-service trainings to our target population. And in in-service trainings, we dealt with issues of human rights abuses of the key populations. We're talking about stigma and discrimination, and we're talking about gender-based violence. And these are the three issues that we think the police we can help in order to mitigate the rates of infection. And then the issue of condoms, we hear all over the world that the police harass key populations with condoms, and what strategy did we use? We produced condoms and were able to convince the Inspector General of Police to make the condom pouch as part of the police uniform. Therefore, each policeman has a condom pouch with a condom inside. And I can tell you, even here, I have my condom pouch with me. It's in my uniform. So this has actually been approved by the police administration, and you have condoms inside. So you don't have any legal basis to see somebody in the streets and then arrest the person for possessing condoms.
Yes, we police have to hold everyone accountable to the laws, but we have to examine the way that we enforce those laws and determine if what we as police officers and prosecutors and judges are doing is having a negative impact and causing more harm than what the initial law was designed to prevent. In Seattle, after years and years of working in silos and bringing legal actions against one another, whether it was the American Civil Liberties Union, the prosecutor's office, the elected officials, the police departments, or the King County Sheriff's Office, we as a collective group, as a consensus-based group, began what's known as law enforcement assisted diversion, which at the point of arrest, an officer can take a low-level nonviolent drug user, an addicted person, a sex worker, or even a nonviolent low-level non-predatory drug dealer who is dealing small amounts of any drug. If that person is amenable to developing a case management plan with a case worker, then that officer can immediately turn the individual over to the case manager, and they develop a plan.
If you look at the determinant of vulnerability to HIV for most street populations, most people who are at risk of HIV around the world, police are the critical determinant of their level of risk of HIV. And yet in this response to the epidemic, we've not sought systematically to engage police as partners. That the essential challenges rest at two levels. One is reforming policy, and that's movement that's going on in lots of different places through decriminalisation of drug use, decriminalisation of sex work, decriminalisation of male-to-male sex. And a second is changing police culture. And again, there are global movements for changing police, reforming police culture, of which we, I think, are a subset. But HIV is one of the doors that opens to all those issues of police culture, of human rights, of the rights of marginalised communities. So we have to use these opportunities to contribute what we can to police reform, to the human rights of marginalised communities, all of which is inextricably tied up with stopping HIV.